sometimes we got patients who come in and you worry if patient has aortic aneurysm or dissecting aorta, then we can do an abdominal ultrasound for the aorta. And how to do it? We just used the abdominal probe. With this abdominal probe, what we need to do is just, if we use this ultrasound, we will know that this is the arrow, because if you divide this to A and B, this will be on the A part and here on the B part. So what we need to do is just put it straight here at the subdefault area, straight down 90 degrees. And on the screen, you will be able to see, okay, there's a large shadow here. This is actually the vertebra, and from here you should be able to see a pulsatile, like a pulsatile coin sitting on this vertebra on this side. This is actually your aorta. And next to the aorta, sitting on this vertebra, is your inferior vena cava, which is not really pulsatile and it's compressible. But the aorta is not compressible and it's pulsatile. If you put color, it would be pulsatile like that. Okay. So from here, you could run down all the way to the bifurcation. So you could focus on the coin. As you run down, sometimes there's a bowel gas. We just wait for a minute, and then it will appear. Yeah? And then you go down, 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 and then it bifurcates to right and left. Common iliac artery. So from there, you would be able to actually measure. This is on the transverse view. If you freeze it, you could measure outer wall to outer wall for the size of the aorta. So you press measure, so you can measure the wall from out to out. So this is about 17.9 millimeters, so it's about 1.79 centimeters. Usually dilated aorta, or when we will call it aneurysmic, when the size is more than 3 centimeters. So here is not even 2 centimeters. And if you measure the common iliac arteries as it bifurcates, you could also measure that one. This is right and left. You could measure it from outer wall to outer wall. It's about 11 millimeters, it's about 1.1 centimeters. And usually we call it aneurysmic when it is more than 1.5 centimeters. Now all these are in transverse view. We could also take a look in a longitudinal view. For example, again, I'm just putting it straight to the subdefault area. Just wait for a minute for the bowel gas to dissipate and hold it. It should come up like that as the bowel gas moves. So if you got the coin which is sitting on the vertebra, you just turn it 90 degrees. There you've got a longitudinal view of the aorta from up to. Yeah? So from here you could see the pulsatile aorta, and freeze it, and you could measure the size even from here. This is the proximal and this is more towards the distal part. The same like you were measuring the aorta diameter just now. Outer to outer. And this part is about 2.35 centimeters. So here you'll be able to look at, especially on this view, the size, whether it's aneurysmic or not. And number two, you will also be able to see if there is any false lumens, especially on this view. If a patient has dissection, you will be able to see a flap and a false lumen. You will see like two lumens. One is the true lumen, the other one is the false lumen. This is the scanning through the abdomen, whereby you will be able to look at the abdominal aorta.